All right. Good evening. My name is Dr. Madeeha Khan. I joined DOC in August in 2025 after completing my residency at the Cleveland Clinic in physical medicine and rehab. And I am practicing interventional pain management at DOC. So that includes seeing patients in the outpatient pain clinic, performing the image-guided pain injections that we do downstairs in the surgery center, as well as performing some of the vein procedures in our vein department. A big part of my role here is helping patients understand their pain because when you understand what's causing your pain, it becomes much less overwhelming and much more manageable. So today, this talk will focus on exercises for back pain relief. We'll talk a little bit about why movement is important, which exercises are most helpful, and how to do them safely. The data shows that back pain causes more disability globally than any other single condition, peaking in working age adults. It is consistently ranked number one cause of disability across multiple global disability reports over the past decade. Back pain is one of the most common reasons people visit their primary care provider. Nearly 80% of adults experience back pain at some point in their lives. And despite the common myths, studies continue to show that bed rest delays recovery and early movement improves outcomes. And this has changed to the point where recently, even in acute injuries, sports injuries, and non-chronic back pain, it is encouraged to start early movement through some mild pain, and that has shown to have better functional outcomes. And so, therefore, exercise is the first line treatment for chronic and acute back pain. And not only is it treatment, but it also is prevention and decreases the amount of future flare-ups. So today's goal is to learn some safe, simple exercises that you can do at home. Exercise isn't just about fitness, it's one of the most effective tools we have to both prevent and treat back pain. And that's for many different reasons. Number one, it boosts brain chemicals. For example, endorphins, serotonin, dopamine. It increases the natural creation of these chemicals, and those naturally reduce your pain. It also increases circulation. With increased circulation, you get reduced inflammation, and that decreases the pain signals in your body, and it also supports healthy tissue healing over time. We also have increased joint lubrication. So people with arthritis in different joints, you over time get reduced lubrication of those joints because that cartilage is gone. And with more movement, you can get more joint lubrication, and that reduces stiffness and allows for more movement. Exercise also strengthens your posture. It helps you stand up straighter. It gives you better spinal support, which reduces strain on those discs and those nerves. And lastly, it also improves flexibility and it reduces muscle tension. Now, these are many muscles that work together to stabilize both the neck and the low back. You can see here there's anterior muscles in the front of your neck, there's posterior muscles attaching to the base of your skull, and there's different layers of muscles. So if you look at this diagram on the right, you can see most superficial or closest to the skin, we have the trapezius, latissimus dorsi, the glute muscles. And as you go down on this diagram, there's many different layers of muscle support, all the way down to the most deep level where we have those muscles that are hugging that spine and giving it stabilization and having the vertebral bodies be more separate so there's less pressure on those nerves. What's not shown here, but what is also especially important is to strengthen your abdominal muscles or your core muscles and also your glute muscles because those are strongly correlated with back pain. The muscles help stabilize the spine and improve posture and body mechanics. So again, abdominal muscles and glute muscles, they play a huge role in body mechanics and are often overlooked. And patients, for example, with C-sections or hysterectomies, large hernia repairs, all those procedures that cut through those abdominal muscles weaken the support on the back because there is connective tissue that connects the abdominal muscles all the way to your spine. And those help support the spine. So a lot of times we have patients in our clinic who have had these surgeries, such as C-sections, which is very common, and they have had this back pain for a long time because those muscles are not supporting your spine. And so the back muscles here start to tighten up to compensate for that loss of support. And again, this is why rehabilitation and consistent home exercises are extremely important. Before we get into specific exercises, let's review a few important safety guidelines here. Number one, make sure to move with comfort and avoid any sharp or worsening pain. If you do get worsening pain, modify that exercise or skip it completely because it is increasing your symptoms and your body is giving you a signal that that exercise is not appropriate for you. Number two, start slowly and gradually. And that means increasing the length of your exercise session, maybe going from 5 minutes a day to 10 minutes a day, or increasing the repetitions, doing the exercises 3 times instead of 1 time, doing them 5 times. That would be increasing repetition. Number three, consistency matters much more than intensity. There are a lot of studies that have shown even gentle movement and more active movement throughout the day, sitting less, standing more, walking more, that is a bigger goal than these intensive HIIT programs or other intensive exercise programs. And that increases quality of life much more than intensity does. And lastly, I did want to mention, always follow your specific restrictions. Physicians, especially after any surgery, do provide restrictions in movement most of the time. So, for example, after spine fusion, typically there's no bending, lifting more than 10 pounds, or twisting in the first 4 to 8 weeks. And also, patients with spinal stenosis, which many of our patients have, must focus on a neutral, so keeping that spine straight up and down or slightly flexed or bent forward. We do not want our patients with spinal stenosis bending back and putting more compression on that spinal cord. So make sure to talk to your physicians about any restrictions. Building a daily routine. So this entails 3 main components. Number one is the warm up. Number two is stretching those muscles to loosen our muscles and increase mobility. And lastly is the strengthening, and that is to increase that spinal stability. So in this webinar, we will be recording this information. So all of the exercises I put on here will also be on our website. So I don't want you guys to be worrying about getting it all down. And if you do want the PowerPoint later on, you can always email us and we can provide you some of those exercises as well. So choose 3 to 5 simple exercises. Make sure to keep it short, sweet, able to repeat every day. Aim for about 10 minutes of exercise per day and progress as your body allows. Try to exercise at the same time each day. And this enables you to build a habit and it reminds you to do that every day. And of course, it is always a good idea to get a formal physical therapy evaluation. They can do an analysis. They are formally trained in providing specific individualized home exercise programs. Even, I say, even to my patients, even 1 to 3 times. Those visits are very those visits are very telling because they can do a full evaluation and give you individualized exercises at home. And instead of going every day, you can also just continue those home exercise programs. All right. The most simple home warm-up to incorporate is walking in place. I recommend about 2 minutes. This walking in place, try to keep your posture to the best of your ability. I know some patients standing straight up is difficult. Lift your knees as high as possible, but within a comfortable limit. The main goal of this section is to get your circulation moving without stressing your back. It increases that hip mobility because we're going to work on strengthening those muscles later. It increases your knee mobility and it gets your circulation moving. So the rest of the workout will be beneficial to you without causing strain on your muscles. Next, we're getting into that second portion, which is stretching and loosening those muscles. So I would recommend starting out with some head rolls. This can be done by standing or sitting. Sit tall in a chair. Make sure your legs are uncrossed, feet flat, hands in your lap, and start with a nodding position. Nod yes, nod no, roll your ear to the right and then to the left. Some people even like to add a little bit more strain by putting their arm over their head and pulling that muscle, all those cervical muscles. But this should definitely be gentle, no sudden movements. Another portion you can add in here, if you see in these pictures 3 and 4, is rotations. So make small circles with your neck, 3 times clockwise and then 3 times counterclockwise. Another tip for this exercise, this stretching exercise, is keeping your shoulders down. I know it's hard when your traps and all these muscles up here are very tight. That's where most people hold tension. And so keeping your shoulders as level as you can during this exercises gives you even a better stretch. Number 2, this is the stretching of the low back. So um, it lists some of the muscles here. Overall, it's the low back muscles and the spinal stabilizers. Again, this is stretching, not strengthening, so you shouldn't be tightening any muscles. You begin with your hands on the floor, your knees on the floor with the knees bent, and you rock forward onto your shoulder and drop this pelvis down. And that brings a stretch to the entire back, including the low back, the mid back, and also your neck because your neck is hanging forward. Nothing should be tense. You should be using your arms as a fulcrum, and you can rock backward after that. Hold. You hold here for about 5 minutes, rock backwards, stretch your arms forward, and hold that for 5 seconds. I am going to give seated alternatives in every one of my slides. I know for most of our patients, or majority, I should say, is it's difficult to get on the floor. And once you get on the floor, it's difficult to get back up. So I wanted to find seated alternatives that do the same purpose. So you can see here, we use our arms as a fulcrum again, but instead of being on the floor, they are on the knees. And you can do that same fulcrum to stretch that quadratus lumborum and those erector spinal muscles. Another stretching exercise is the sitting rotation stretch. This is great not only for your low back, but it's also good for the abdominal muscles and the piriformis, which is a big culprit of sciatic, what people call sciatic pain or shooting pain down the leg, and that is in the buttock muscle. You sit on the floor, you can straighten out both your legs, and then you cross one over the other. You bring the opposite arm, you put that elbow on that knee, and twist your torso. Again, if this increases pain, stop immediately, but this is a great stretch for both those muscles. Make sure to sit up as tall as you can. Keep your sit bones pressed through the floor throughout the entire stretch. There is another seated alternative here. If you are able to cross your legs, that would be great to bring more of that piriformis in. Otherwise, this picture shows solely that back stretch and the abdominal oblique stretch. Another stretch is called the modified seat straddle. This works mainly the back of your leg, so it's more like a hamstring stretch and some of your low back muscles. So you have, it's more like a half butterfly if you are done the butterfly in gym class. So you're seated on the floor, one leg is straight out and one leg is bent. If you can't fully reach your toes, definitely you can hold on to your shin, go as far as you're comfortable, where you feel a good stretch in your back. Another tip here, keep your back straight. A lot of people tend to round their back in this exercise. That defies the purpose of the exercise. The point is to stretch those back muscles. So we should be bending at the hip or at the pelvis, bend forward at the pelvis. Same idea in here. You see him bending forward at the pelvis, holding onto the shin because he probably can't reach those toes. And that gives a good stretch to your hamstring. Another tip here, I would start with the leg fully straight. But if you want to get a different areas of that hamstring, different physical therapists have told me that a great strategy is to bend that knee a little bit, and then you'll feel the stretch in a different area of your hamstring. Number 5, knee to chest. This is also another great low back stretch, laying straight on your back, tightening those abdominal muscles, bringing that knee up to your chest, holding it there for about 5 seconds, switching to the other side, and then doing both at the same time. Again, important to keep those abdominal muscles tight and pressed into the floor so you're fully stretching those back muscles. Number 6 is the bird dog. This is, I would say, a low back pain therapist favorite. Every single um, every single time I've asked a physical therapist, they've always wanted to um, focus on this bird dog exercise. Traditionally, it's done on the floor. You're on all fours, hands straight down, knees bent. You bring one arm up, and once that's stable, you bring the opposite leg back, straight back. So that really stretches that low back. And then you do the same on the opposite side. This is a great alternative because you're not only supported here on the base of the chair, but your extended arm is also supported on the back of the chair. So I really like this alternative to the bird dog. Now we are getting into the final portion of the exercise routine, which is strengthening. And we are starting off with a really strong exercise. Many people know this one. It's the plank. This works on almost every single spine stabilizer, back extensors, erector spinae, the quadratus lumborum, all the abdominal muscles, and even the glute muscles. But for this one, it is very important to have proper form. We traditionally do this on the floor with your elbows bent. The elbows should be right under your shoulders and toes up. Make sure to keep that pelvis straight. That's where a lot of times people make the mistake. Their pelvis drops down and it strains the incorrect parts of their back, and their abdominal muscles are not firing. So make sure to keep that straight. It's recommended to hold it for 30 seconds. Many people cannot hold it for 30 seconds. So a trick behind that is to bend your knees and have your knees touch the floor. That adds a little less weight and is a little bit more manageable for most people. Um, and then another alternative here is the plank alternative, where you're standing, you have your elbows on the wall, and you're treating the wall like the floor. It's important again to keep those stomach muscles tight, and this targets again all of the main spine stabilizers. There is a modified side plank. This gets a little bit different area of your abdominal muscles. So it gets those external obliques, which is wrapping around and connecting to the back. Um, Again, we have you laying flat. The bottom leg is bent. The top leg is straight, touching the floor, and the elbow is bent on the floor, and you slowly contract your abdominal muscles and lift up off the floor and try to hold that position for 15 seconds or as long as possible. In all of these, make sure to keep your neck in proper alignment with your spine. Hip bridge. This is also another great one where you are laying on your back. You have your arms straight down and you slowly contract your abdomen and your glute muscles and lift that up and hold it for about 15 seconds or as long as possible. Come back down, take a break, and continue those. Seated alternative is the banded exercise. There are many different exercises for firing glutes. I think this is a really good one, a safe one to do while seated, and it adds a little bit of resistance once you put that resistance band on. You separate the knees, bring them back together, and that fires those glute muscles. Abdominal bracing. This is the last strengthening exercise I have here. For this one, you lay flat on the floor and you push those abdominal muscles into the floor to contract those abdominal muscles and hold that for 15 seconds. You can do it seated as well by pushing into the chair. And make sure to flatten that lower back onto the floor or onto the back of the chair. And you hold that for about 15 seconds. Moving on to a few extra tools to keep in mind. There's going to be two of them that I have here. Number one, it's something called nerve flossing. I don't think many people have heard of this, but it is becoming more and more popular. When I was at the Cleveland Clinic, a spine trained specialist, physical therapy specialist, he taught me this maneuver and it has worked great for many patients. This is called nerve flossing, neural gliding, or nerve mobilization. This is for patients who have what is commonly called sciatic pain, technically called radicular pain, both in the shoulder and the neck down in the shoulders into the arms, shooting pain, or from the low back shooting into the legs. The idea behind this movement is to increase that movement of the nerves. And I'll talk a little bit about that in a second, but I do want to explain the exercise first. If you look at this photo down here, the lower picture, you place tension on those nerves. So for people who have sciatic pain, they know when they sit for a long period of time, that adds stress onto the low back and that nerve flares up. So they are in a seated position in this picture, which already is adding stress. One, if you bring your big toe up and bring your ankle up towards your face, that adds even more strain on those nerves. And then if you look up at the same time, that decreases strain on those nerves. So, in a sense, you are flossing the nerve because you're gliding that nerve up, you're adding pressure here, and you're releasing pressure through the head. And then you do the opposite. So, look, the head is going in the same direction as the toe. So, the nose is up, the toes are up. The nose is down, the toes are down. And you keep going in those cycles. It's similar for the neck. And the theory behind this, number one, if you have an injury, such as a bulging disc, herniated disc, if you had surgery in the past, any reason for inflammation, your nerves are going to get adhesions and scar tissue around that nerve sheath, and it's going to make that nerve restricted, which causes more pain. So by flossing this nerve, it's decreasing that restriction and increasing motion. Number two, there's a theory with all of this sciatic pain, you can get intraneural swelling. What that means is the nerve itself starts swelling, and that causes pain. So by doing these pumping movements, you can get more circulation and decrease swelling in the nerve. And lastly, it also desensitizes the pain receptors. So, for example, if you have sciatic pain and you're lifting something, you have that shocking pain. Your body thinks it is a threatening input and you sense extreme pain. This exercises tries to get the body slightly used to that input, that pain input, in a non-threatening manner. So over time, it does not perceive it as a significant threat to the body, and therefore you will perceive less pain. So the way you do this exercise, let's say you have low back pain that shoots all the way down to the toes. You will sit down. You will slowly bring that leg up until you feel slight pain. You're starting to feel that sciatic pain, and then you will bring your foot a little bit lower than that. So the pain goes away, and then you start the flossing. So you bring your toe up, down, and same with the head in the same direction. That's how you properly perform this. This is not supposed to cause increased pain. This is supposed to slightly touch that nerve to increase that input and decrease the pain cycle. Same thing with the hand and the neck. It is a little bit more complicated with the neck, so I won't get too much into that one. The last tip I wanted to give is when we are in constant pain, our bodies freeze. They freeze in something called the fight or flight mode, also known as the sympathetic response. The opposite of that is a parasympathetic response, and that is our rest and digest. So that is when our body is relaxed. Usually patients with constant pain, they are in this fight or flight. So we need to stimulate the opposite to relax our nervous system, and that reduces muscle tension and reduces pain. There are a few exercises to stimulate the vagus nerve, which is part of that parasympathetic relax and rest system. Some of these are listed here. You might have seen the recent trends of cold water therapy. A lot of people have been doing ice baths or putting their face in ice water. before or after their workouts just to get more of that parasympathetic relaxation response. That's also why I put those neck stretches in the beginning. That also stimulates that vagus nerve. We also had the spinal twist in there. That is also another great one to stimulate that vagus nerve, ear massage, gargling water, deep breathing, singing or humming. All of these, and I know there's many more, are ways to increase vagus nerve stimulation. And that can be very helpful either at the beginning or end of your exercise routine. We have now completed the portion of the talk discussing the specific exercises, but I did want to talk a little bit about the data that is on formal exercise classes. There have been recent large reviews, systematic reviews that show the following exercise programs to be extremely beneficial in pain, in reducing pain, and also reducing disability. So some of those formal classes, out of all of these, Pilates had shown the highest likelihood for reducing pain. 93% of the patients had reduction in pain, and 98% had reduction in disability. The most beneficial programs that they reviewed had the following characteristics. They had 1 to 2 sessions a week of exercise. Their sessions were all less than 60 minutes. And again, focused on those core muscles, the abdominal muscles, strengthening the spine muscles, and also mind and body exercises, just like the vagus nerve stimulation we were talking about. And all the lengths of the program were about 3 to 9 weeks. Number two, core stabilization programs. Those did great in terms of pain and disability reduction. Tai Chi, that was actually the first studied exercise that showed improvement in pain and disability in studies. Walking and also yoga. So all of these, if you're looking at different exercise programs and thinking about which one to join, all of these have shown great benefit for reducing pain and disability. I also wanted to talk a little bit about Silver Sneakers. This is a program for patients who are 65 and older through select Medicare plans such as Medicare Advantage Part C and Medigap. They provide free access to gyms, community centers, and they give virtual exercise classes. I have personally attended, I am not 65 or older, but I've personally attended this with my patients while I was doing my residency in physical medicine and rehabilitation. And I think they are great. I highly recommend this to any patient that qualifies. And it's great because a lot of them are virtual. Most of them are daily or multiple times a day. I'm going to mention the McKenzie therapy. This is an additional training. So physical therapists who have completed their training in physical therapy can choose to go on for advanced training in the McKenzie therapy method, and that is to specialize in spine rehab. Unfortunately, every time I've looked and put the date and zip code in, there are not any providers in the area. We had many around Cleveland Clinic, so I would always recommend my patients to go to a McKenzie trained therapist. But the reason I mention this here is because there are many resources available online mentioning this McKenzie therapy method. So I wanted you to be aware of what this meant. In summary, all of our exercise programs should consist of these three components: warm up, stretching, and then strengthening. It is more important to be consistent with light movement than inconsistent with more intensive exercises. Listen to your body. Find exercises that you can easily do that do not worsen your pain. And again, we talked a lot about which muscle groups to focus on, which I've listed here, including those spinal extensors, the glute muscles, and the abdominal muscles. I think knowing those muscle groups, it is very easy to find different exercises online. So knowing which muscles to work on should be helpful in formulating your exercise program. And if you have any questions at all, please send them to this email address. It's info@daytondoc.com. Again, this webinar will be loaded up onto our website at Doc Talks, and you can find that recording there. So if you have any questions, if you see me in the surgery center or in vein or in the pain clinic, feel free to ask me any questions. But I hope this was helpful for you all to have a takeaway and have some exercises that you can incorporate into your daily routine. All right. Thank you so much.